So it's been a year now since I found out that I was pregnant, and then I miscarried, and I don't seem to have fallen pregnant again. So I went to my GP last month and I just said to her, look, I managed to fall pregnant the first time and I just don't understand why it's taking so long this time. She sent me for a blood test which tested my progesterone levels, and it just confirmed that I was ovulating. And I kind of knew that everything was okay on that front because I was taking ovulation tests that I bought from Boots. They give you like a smiley face and then a blinky face when you're like at high fertility. And Mel had his tests and he has super sperm. We're just kind of like not understanding why it hadn't happened. So I should probably preface this with saying that when I miscarried last year and they performed an ultrasound to say that yes, sadly you have had a complete miscarriage, they also discovered that I had 3 multiple fibroids and they were bunched together. At the time I didn't realise, but they were actually quite big. So they measured 6mm by 6mm, so like about the size of a tennis ball, they said. And it's really weird because when I said to them, look, do they need to be removed? They said, no, this is really common in women and also it could potentially affect your fertility going forward. So I was like, okay, we'll just leave them where they are then. Fast forward a year, it's been a year now. Last month I went to see my doctor, and I went to go and see my female doctor this time actually, because in the past I'd seen a male doctor who I just didn't feel like gave me the time of day. And I think that was probably one of the best decisions that I did, because my doctor didn't just sit with me for 10 minutes. She went like through my whole full medical history, sat with me for like almost, I think, half an hour. Even though it's like a biological function, like the process of getting pregnant, having a baby, it's as much an emotional and psychological thing as well, because it just takes it out of you, literally. Every month that we try, my hope builds up, and then I get my period and it's just extreme disappointment and frustration and wondering, was there something that I did that month, or was there something I could be doing? And then she said, I'm going to send you to the fertility clinic and you'll have some other tests done, and we may as well send you for an ultrasound as well, just to check the whole pelvic area. I went to a hospital appointment last week and I met with the fertility kind of gynae people. Sat down, told him what had happened to me, and he said, okay, we can do a dye test which checks if your fallopian tubes are blocked. It may be that somehow they've become blocked. And this is a laparoscopic procedure. So they go in through the belly button and they use a laparoscopic kind of camera. And he said, we're going to put you on a 3-month dose of taking a tablet called Ismaya, which is going to shrink the fibroids by 40%. I think it's kind of like a progesterone inhibitor. And I think it's going to stop me having periods for 3 months, and it's therefore going to maybe stop the blood supply to the fibroids, and that's hence why they shrink. So I'm going to do that for 3 months, and then I'm going to go in for this surgical procedure. So they insert the laparoscopy into the middle of the belly button, and they make some other small incisions, and then they do the myomectomy, which is the removal of the fibroids, and then they're going to do the dye test as well. So to be honest with you, when you told me that, I was a bit like, wow, I wasn't expecting to like have surgery. And he said it would be all under general anaesthetic as well, which I've never had before. And I was just like, okay, that's quite a lot to take in. And it's weird because when I had my ultrasound and they said that I had fibroids like a year ago, you know, they said you don't need to have the fibroids out. So I didn't understand why now I had to have the fibroids out. And I said, okay, well, can you just explain to me, is the presence of fibroids impairing my ability to conceive? And he said, no, but they might help to reduce your chances of miscarrying again. So I was like, okay, well then, if that's the case, that's definitely worth having, because I don't want to miscarry again, because it was such a traumatic and horrific experience. I'm also worried that if they remove the fibroids, it may leave scar tissue on the outside wall of the uterus, and I'm worried that that might, I don't know, detrimentally affect my chances of getting pregnant. But then again, my chances of getting pregnant are so crap at the moment because it's taken a full year and nothing's really happened. And then yesterday I went to my ultrasound appointment. So this time round, he said, actually, you don't have multiple fibroids like bunched together. You have one on your left subserous wall and one on your right subserous wall. So I was like, okay. It's like being told 2 different things and you think you have one picture of how things are and they're not. So I was like, okay, that's sounds better to me, because if they're not multiple, it might be that they'll be easier to kind of cut out and remove. And then he said, I'm going to check your ovaries now. And then he said the right ovary is polycystic, and so is the left ovary. And I was like, what? I was literally trying not to freak out, because although I don't know lots of things about people with polycystic ovaries, I know that they can be a great barrier and impediment to falling pregnant. So I was like, hold on a minute, not only do I have fibroids, I have like these polycystic ovaries. And obviously he couldn't really elaborate because he was performing this diagnostic like thing. I was like, okay, like quietly freaking out in my mind. And then he said, let's check the position of the uterus. And he said, it's retroverted. And I was like, what? I was just trying to compute, and also trying not to interrupt him as he was like narrating what he was doing and what he was finding. I came out and I literally just started crying. I thought that the ultrasound appointment was just going to be completely routine. So I went on my own. I said to Mel, don't worry about coming with me. But then to find out that obviously my fibroids are in a different place, but then also to find out that I've got polycystic ovaries and my uterus is retroverted, which means it's not facing or tilted upwards towards my stomach, it's tilted down towards my rectum. I was just like, literally every time I go to this hospital, I get told bad things. And I don't know, I just feel I feel really down today actually, and I feel very upset. The radiographer did say it may not necessarily mean that you have polycystic ovary syndrome, because I am having regular periods. But I don't know, it just makes me really wish that like I'd carried my first baby to term, and like I hadn't had that miscarriage. To come back to the drawing board and then have all these kind of obstacles and problems, it's just, I don't know, it's kind of like a little bit soul destroying. And I know in the scheme of things, my problem relative to other people's problem it's not that major. And I'm trying to put things into perspective. But it's just things really suck right now is, I guess, what I'm trying to say.
How are you feeling? Any pain at the moment? Sorry? I'm just taking out the blood pressure, darling, alright? And I need to check the one side. Is that alright? You're still feeling cold, are you?
It's been 7 months now since my operation. Let me talk about the actual operation day itself. I remember feeling really stressed. Actually, I'd really worked myself up into a frenzy because I'd never had general anaesthetic before, so I was absolutely petrified, concerned that I wasn't going to wake up. Stupid, ridiculous, I know, but you're not thinking with your kind of clear mind like you normally would. And also, I was just really petrified about having the operation itself, because it's pretty invasive. Even though it was keyhole surgery, they give you like these information leaflets just here, but they're very detailed and they're very visual. So it's jammed packed full of information, and sometimes too much information is not good. Like what's that saying? Ignorance is bliss. Sometimes in this case, when you see all those implements and instruments going inside your kind of reproductive area, it can kind of make what you imagine in your head worse. Mel dropped me off, and the nurse was like, you're like 5 or 10 minutes late, and I was like, I'm ever so sorry, but I'm in a bit of a state right now. And they were like, well, you're the first on the operating list, you're first out of 9 ladies. And I was like, why am I the first person? I don't want to be the first person. I need to kind of calm and collect myself and pull myself together. And I said, is it because my operation is more complex and more complicated than the others? And he said, yeah, and the surgeon wants to kind of do you first. I was like, great. Anyway, I think that was a good thing, because it meant that I didn't have more time to dwell on what was going to happen to me. Briefly met the consultant, met the anaesthetist, and before I knew it, I was out for the count. So I had a laparoscopy, I had ovarian drilling, I had a hysteroscopy, and I had a dye test. The laparoscopy was just to investigate what possible causes there were for my subfertility. So I actually have a name, I'm subfertile. Great. And so they had a good old investigation, and one of those is doing a dye test. So they inject blue dye into your fallopian tubes just to make sure that they are clear, so that the egg and sperm can be released in the normal way. Fortunately, my fallopian tubes are clear, and I had a nice blue, bright blue Smurf bottom for the next 2 weeks to prove it. I was going to have a laparoscopic myomectomy. Now the myomectomy was to remove the fibroids, so they gave me a tablet called Asmaya, and that helped to reduce the size of the fibroids significantly. So they went from being 6 centimeters to 3 centimeters. And actually in my medical notes here it says that there were 2 subserosal fibroids which were not significant, so they weren't big enough to warrant removal. So I was pretty relieved at that. I had ovarian drilling. Like I said, it's lovely, isn't it? Every woman wants to have her ovaries drilled, but basically because I have polycystic ovaries, which is a fairly new kind of diagnosis for me, I have more follicles. So I think the average female has 5 to 10, I have 20. And those follicles that I do have are encased in a cyst, which might mean that the egg isn't released in the normal way. So they drill it to help release the egg, and hopefully, obviously, that will help in conception. When I woke up, I was extremely, extremely drowsy, and actually it took me a long time to come round fully, and I was one of the last people actually to be discharged on the day. I remember coming home, and I was pretty much out of it just because of the painkillers that they had given me. The main thing with me was that my belly had swollen like a balloon. You think about when you have a period, your belly really gets bloated. This was probably like 3 or 4 times worse. I felt like I'd eaten a massive curry and then a roast dinner and then some noodles and some soup and something else like that. It was massive, and the reason that is because they pump you up with CO2 to expand the whole area so they can have a good old rummage around your reproductive kind of organs. So they made some incisions here, here, and in my belly button, and those were extremely sore, and I just generally was in a lot of pain. And during the next couple of days, the pain in my shoulder, I had this pain in my shoulder, and that's because of the CO2, it rises up to here, because it's obviously trying to escape. That was just really painful. Everything ached. I felt so sore inside. It's really strange to say that, because obviously you don't have any, I don't think you have any nerve endings in your organs. They're all on your kind of skin. But I just felt like they'd really kind of gone in and just messed with my insides. It was just a horrible, horrible feeling. And I came up to bed that night, and I just remember I just couldn't sleep. I'm the sort of person that always likes to sleep on their sides, but I couldn't do that because obviously I had the stitches and I didn't want them to rupture. So I was forced to sleep on my back. You lie flat like that, and I couldn't even walk up straight. It just makes the skin stretch, and you're already really, really sore. So I was kind of like bent over like that. I ended up sleeping on the sofa for that first week, just because it was the only place I could get semi-comfortable. I remember the next day I got up and I looked at my dressings, and the one in my belly button, I think they'd had a good old go down there. It was bleeding, and there was like quite a big clot, so I was really concerned. I phoned up the day surgery, and they was like, we can't deal with you now because you've been discharged. The best thing for you to go is to go to A&E and get checked out, so I did. That in itself was traumatic because I had to wait a couple of hours again, and you're just like, one day, not even post-surgery. They redressed it and they said everything's fine, it's not got infected. I don't think I had a shower for the first 5 or 6 days. I just had like, Mel got a flannel just wiping me down, making sure I was clean. I've got to say how wonderful my mum and dad were. They came over and made me food. My friends Dawn and Natalie came over. Natalie made me a really yummy curry. My best friend Lynn came over as well. She brought me duck and rice from Chinatown. It's one of my favourite meals to have. And my friend Dee came over, and there was no way that I could lift my leg up to even try and get into the bath. So she came over, and I just literally gently put my head over the side of the bath, and I remember her just pouring the water on it with the shower head and just washing my hair. Do you know what? I had disposable stitches, and they were meant to dissolve after 6 weeks, but they didn't. And then I couldn't get an appointment to see my nurse until the 8th week, so they'd been in there a really long time. So when she ended up taking them out, they didn't want to come out because they'd crustified. Oh my gosh, it was awful. And all in all, it took me 5 weeks to recover and to be able to go back to work. So I think the advice was, from all the leaflets and things like that, was to not try to conceive again until 8 weeks post-op, just so that everything is fully healed. Maybe in December we started trying again, so it's been December, January, February, March, April, May, so it's been 6 months, and I'm really sad to say there's been no sign of getting pregnant. I don't know, I have had really like high hopes, because when the consultant came to see me after I'd woken up, he said, everything is normal, everything is fine. and I expect you to have beautiful babies. And I just can't get that, his smile and the way he looked at me out of my head, and it just gave me so much hope. I had such a surge of hope that within the next couple of months after having this surgery, you know, there might be the glimmer of 2 lines on the pregnancy test. But unfortunately for me, as of the 3rd of May 2018, there hasn't been another pregnancy.